Good evening. So shall I start?
Yes, 1 minute, please. I'll just give an introduction and then we can proceed further. So, good evening, everyone. Uh, really happy to join again in the weekly webinar sessions with you all. So, for the past 2 weeks, I was not there. So, it's really happy to be back, and I think this learning is going well. So, next second. Yes. Thank you for joining the session on implementation research today by our fellows Dr. Spurti Chate and Dr. Shivangi Chaube. Dr. Spurti is an assistant professor, Department of Community Medicine from Symbiosis College for Women, and Dr. Shivangi is a site surveillance officer from John Snow, India. And today, our fellows are going to talk about the research designs, implementation research designs, and case study regarding the implementation research. Following our previous session on operational research, bottleneck and root cause analysis, this session is going to elaborate more about the research in public health programs. Thank you for everyone, and we look forward to the conversation ahead, and we'll take all the questions towards the end. Over to you, Dr. Spurti.
Good evening, everyone. So starting with today's topic, it's giving the overview. We'll be covering the following under the following headings. Next slide, please. So as we know, preclinical research, it involves mainly the study of normal biology and disease processes. Clinical research mainly involves all the clinical trials involving the people and people or patients. And implementation research, it involves the interventions mainly focusing on improving the health through delivering proven interventions. Now, next slide, please. So implement is it is derived from the Latin word implere, which means to fulfill an effect or carry into effect. Kindly change this. Yeah. So implementation research is the scientific inquiry into questions concerning implementation, the act of carrying an intention into effect. Now, in health research, next.
Spurti, you just got muted. Sorry.
So next slide, please. So implementation research, it links evidence with practice to scale up health programs. It mainly helps in identifying what, why, and how interventions work on the ground level, taking into consideration the cultural context as well as other factors, and does impact the success of the intervention. Now, next slide, please. The basic intent is to understand not only what is and isn't working in the health program, but how and why implementation of it is going right or wrong, and testing approaches to improve it. So next slide, please. Yeah. Why is research on implementation needed? As we know, neglecting implementation challenges, it costs lives as well as money. So it is nothing but wasting of the sources. So despite abundant evidence of the efficacy of life-saving interventions, we know that delivery of those interventions effectively is very important, which is seldom very low. So that is why a study of implementation research is needed. Now, mostly, next slide. Yeah, mostly the person in the field, it could be the doctor in the remote rural clinic, or the midwife or nurse in the local community, or any villager who may face a problem and come across certain questions which may be the starting point for the critical new thinking. Next slide, please. So because of it, uh, the properly conducted implementation research with its all important focus on context can help implementers foresee and anticipate problems with their new thinking and thus come to some solutions. So context, problem, and solution finding, these are all interlinked, and that is what implementation will do to improve the effect of the intervention. Next slide, please. So this is one example. Now, in the early 1960s, in Nigeria and related countries, there was a small pox outbreak, and many cases were involved. So the orange dotted line shows that initially there was peak. They tried to curb it, so the cases decreased. But however, again, they couldn't curb it, or they couldn't prevent whatever health program they were focusing on. That wasn't effective because the number of cases in between 1960 to 1967, it went on increasing, as you can see in that orange dotted line. So many researchers thought over it, and then there was one doctor from Africa who worked upon it, who asked questions, and he came to the conclusion with uh, involving local communities that wherever there are containment zones, that is the place from where smallpox is getting communicated, or it is getting transmitted, and they have to work on that and develop herd immunity in the entire community. So that is when, if you all can see the black line, that is from 1968, they started working upon it. This is how they started implementing from the grassroots levels in various containment zones and taking proper precautions and conducting the program. And that is how there was decline without any bigger peak in the smallpox cases. So this was implemented in almost 20 West and Central African countries. Even in India, in Tamil Nadu, around 41 cases during that period were contained using the same implementation research method. So this was one example. Next slide, please. So this context of please, previous slide. Yeah, the prevention of mother to child transmission cascade in Zambia. Now this bar graph, it shows the various number of, or the cases of pregnant women tested with HIV and their CD4 counts detected, along with the results and ART treatment initiated, as well as who were found eligible for it. So if we can clearly look into this bar chart, we see that there is dropout rate. This clearly shows that the implementation, though there are resources, though we can curb, we can prevent the, or take care effectively regarding the pregnant HIV women, there is significant dropout rate. Yeah, at every level. It could be CD4 counting or initiating ART treatment as well. So this shows that that is why implementation is so important. Though there is a national health program, if we can implement it properly, we can reduce the dropout rate and thus achieve success in implementation. So this was about the second example. Now, how is implementation research used? We usually we see that implementation research takes what we know and it turns into what we do. So basically, it is a practical approach, not just theoretical. Now, even when interventions used are similar, we see that implementation occurs differently in different contexts and produces different effects. So next slide, please. So if we see certain interventions, they work very well at smaller levels, involving very few number of people. But the same thing, if we are using it in a larger population for a bigger health program, especially in national health programs and other strategies, they heavily fail. So this shows that there is an importance of implementation research, and it has to be used with context specificity in the real world, involving various factors. Next slide, please. Yeah. So the crucial context, the crucial importance of context in the successful implementation of interventions is what is needed. So coming to the context of real world. So this was what I was talking. Real world, it involves everything, mainly the community health system and economy, uh, which is with which the interventions have to, we say, interact. So we know what works, but do not always know how to make it work in the real world. So if we work on this in trying to know how to make it work in different contexts, that will itself lead to successful implementation. Yes, next slide. So this is again another example. It's a very good example. In 2002, the Taliban and Afghanistan were not in good terms, and there was a lot of war and a lot of health related issues in the population existing in those areas. So this happened in 2002. So during that time, there were some NGOs and some here and there with health caregivers who initiated and brought this national balanced scorecard, that is in order to take care of their population. So what they did was they had various domains. Like if you all can see in this chart just below it, black dotted line is domain A, which involves patients and community. Similarly, we have for staff, for capacity and service provision. Then we have for financial systems and overall vision. So these things they studied by maintaining this balanced scorecard. They made basically a scorecard to and track their health record. The way in which it was implemented was studied, and it showed that because they had an effective strategy in implementing, there were decline and other changes, but overall from 2004 to 2008 it was a successful implementation. So the general overall health of the people residing in the post-Taliban Afghanistan has shown to be good, according to this, in the area where this was implemented. So this is another example of it. So how to use questions mainly to study the implementation research and what will be its uses. So the benefits of implementation research will be more where research is answering the questions that decision makers and practitioners ask or will have to ask. So research is implementation heavy when it addresses questions focused on implementation, mainly occurring in real world settings, and at least considers factors that affect the implementation. It could be various factors. So yeah, this is another example. This is from a hospital screening. This is cancer related program actually, where number of screening and follow-ups were taken. But before giving any intervention, if you all can see the first column, the number of women according to their age and the samples collected, the lab results, etc., are given. So there is a significant quality improvement on screening and follow-up for cervical cancer after intervention. So post-intervention, the second column, if you all see, there is good quality improvement. So this itself shows that if the implementation is done in a proper way, there is successful. This is called successful implementation. There is quality improvement. So you can see here the number of women detected were initially just to around 2,400. Then there is a jump of around 1,000 post intervention. Similarly, there is significant the number of unsatisfactory samples were more initially. They were around 41, but after intervention it is reduced just 14. So that is what this picture depicts. Next slide, please. So there are various strategies to improve implementation in health. So first the questions come, then there is new thinking, and then there is change in implementation, and then they use strategies to improve the implementation. So I'll quickly going through this. I can just name. So government also acts as one. They have certain strategies, usually policy making and finance related. Then implementing and provider organizations, it is organizational most of the times. Then individual providers and frontline workers, that is where individual practices, especially related to the education, training, jobs, and learning is involved. Uh, these strategies, they strategize, they come up with new different types of strategies and help in improvement of implementation. Next slide, please. So next is communities and households. So again, there is empowerment, empowering through education, participation, and individual practices. So there are a number of examples that are given, and also multiple actors who are assessing and stakeholders with the help of many management related feedback, other things are involved. So this is how different types of strategies are used. Next slide, please. So who should be involved in implementation research? Successful implementation research is through successful collaboration only. So anybody and everybody can be involved from the beginning till the end. Only thing is it should be a successful collaboration. So usually the feedback that is generated from the implementers, next slide please, the feedback that is generated from the implementers and the expertise of research methods given by the researchers, these two are very important and they are needed for carrying out trustworthy studies, and thus implementation research can become successful in proper implementation of the health related programs. So feedback from the implementer and researcher related expertise of research methods is very important. So those who know this, they should be involved in implementation research. Now next slide is about what approaches and methods are appropriate for implementation research. It involves wide variety of approaches. So qualitative methods, quantitative methods, any of the mixed method researches can be used. So with this, I have covered my initial part of presentation. The remaining part will be covered by Dr. Shivangi. I once again apologize for the inconvenience caused due to the system. Thank you.
Thank you, Dr. Spurti. So we can now over to you, Dr. Shivangi, to continue with the next part of the session.
Yeah, sure. Yeah. So thanks, Dr. Spooty. I will be taking lead from the implementation outcomes. So till now we have understood like what is the implementation research, what are the implementation strategies, and what are the implementation interventions. So how we will measure those interventions, we will and what are they? So we will learn about implementation outcomes in this slide. So what are implementation outcomes? So these are defined by the Proctor et al. As the fact of deliberate and purposive actions to implement new treatments, practices, and services. So basically, implementation outcomes are the result of implementation activities or implementation strategies. So they measure the effectiveness of implementation, whether the implementation is effective or not in our settings. So we need implementation outcomes for that. So why we need separate implementation outcomes? So first, the implementation outcomes, they serve three important functions. So they serve as the indicators of the implementation success. Whether our implementation strategy or our program is successful or not, we will measure through the implementation outcomes. So they are the indicators. So they are the proximal indicators of implementation processes. And they are the key intermediate outcomes in relation to service system or clinical outcomes in treatment effectiveness and quality of care research. I will go through in detail in further slides. So implementation outcomes are basically the preconditions that are required for desired changes in clinical or service outcomes. What desired changes we want in our clinical or service outcomes, implementation outcomes are serve as a preconditions for that. So what usual studies measures, we will have an intervention, then we will see the causal relationship between the intervention and the patient outcomes. But in implementation science or implementation research, we will see the implementation, we will see how, like how these intervention strategies or intervention get through these, which result in successful outcomes, which will further impact the service outcome and in turn the client outcomes. So here the importance is not the evidence-based intervention. We have the package of intervention plus the implementation strategies, which will result in successful implementation outcomes. So this is the conceptual framework of the implementation outcomes, which was given by Proctor et al. So I will go through in detail in further slides. So first we will discuss about why to focus on distinct outcomes in implementation research. We have separate studies, but we don't focus on distinct outcomes. So why there are different implementation outcomes are there. So first we will see that why a program fails. There's a policy or program we implement, but what are the reasons why they fail? So there can be two type of failures. First is intervention failure, like the intervention was not relevant or appropriate to the problem or population of interest or setting. So the intervention was not evidence-based or the intervention was not appropriate. Another one comes the implementation failure, which is the interest of this in this implementation research. So a good intervention which was incorrectly deployed. So that will result in implementation failure. So the evidence-based intervention, there are a lot of clinical studies which earlier was done, and there be evidence-based intervention plus an effective implementation can result in successful outcomes. This is the core of implementation research. So what is the difference between the clinical outcomes and the implementation outcomes? So clinical outcomes are the result of clinical intervention that measure the change in health of population. For example, if there is a program like NCD program is there, and you want to measure, you implement an intervention, and then, for example, a depression screening, you will measure the change in PHQ-9 score sometimes. So these are the clinical or patient outcomes. In the implementation outcomes, you will not focus more on the clinical outcomes, but that are the result of implementation activities, the strategies which you have used, that outcomes will measure the effectiveness of the implementation. So they will serve the preconditions for achieving the desired clinical outcomes. Like what are the strategies you have used to make these intervention successful? So these are the taxonomy of implementation outcomes given by Proctor et al. So there are around 8 implementation outcomes. First is like acceptability. So acceptability is like if you implement some program, so do providers or patient find the intervention agreeable or satisfactory? And then adoption. Adoption is are providers delivering the intervention or not? It is the intention, initial decision or action to try or employ an innovation or evidence-based practice. It is the uptake, like whether an organization or provider has uptaken the implementation or not. Then next comes the appropriateness. Appropriateness is the perceived fit or relevance or compatibility of the evidence-based practice for a given practice or setting. Then comes the cost. Cost is the cost impact of an implementation effort. For example, if you are providing a program or effective package to a government, so you should know what is the implementation cost of that strategy, whether it is cost effective or not. Then feasibility. Feasibility is if the intervention is feasible to implement with the given resources and constraints within the facility. Then comes the fidelity. Fidelity is whether the intervention is delivered as per the protocol or not. What was the described protocol? So whether the intervention was delivered as per the protocol or not. Then comes the penetration. Penetration is defined as integration of practice within a service or setting. Means, for example, if a training you have given, so have all the facility staff have been trained in the intervention or not for starting a new innovation. Then comes the sustainability. So sustainability is defined as sustainability is whether this intervention you have implemented is maintained in the organization or not. So how long the intervention is maintained in the organization. So there are few basic difference between the outcomes in the different trials. So in the efficacy trials, like randomized controlled trials, we maintain the high internal validity. We will have limited external validity. Sorry. For example, we will measure here like, is cognitive behavioral therapy for child and anxiety efficacious in research setting? So we are measuring here the cognitive behavioral therapy. This is an intervention for child and anxiety is efficacious in research setting or not. In the effectiveness trial, what we will measure, this is the real world settings. We will take the more diverse samples here, and here will be the better external validity as compared to the efficacy trials. So in this, what we will measure is CBT, that is the evidence-based intervention for child and anxiety, is effective in real-world setting or not. But in implementation research, what we will focus on the implementation process of an intervention. For example, can training and consultation as implementation strategies improve the implementation of cognitive behavior therapy for child and anxiety? So here we will focus more on the training and consultation as implementation strategies, whether they have improved the implementation of cognitive behavior therapy for child anxiety in real world settings. So this is the study which was done by in Ghana. So evaluating context-specific evidence-based quality improvement intervention on lymphatic filariasis, mass drug administration, northern Ghana using the REAM framework. So what they did in 2017, before the 2017, there was mass drug administration for lymphatic filariasis in northern Ghana, but the result was not satisfying, and there were not much drop in the reduction of filariasis. So in 2017, the TDR, the Special Program for Research and Training in Tropical Diseases, funded a project to conduct implementation research toward the elimination of lymphatic filariasis in northern Ghana. The aim of this study is to evaluate the process and impact of the intervention on implementation of lymphatic filariasis mass drug administration in Bole district of northern Ghana. Sorry. So they have done an initial need assessment to identify implementation bottlenecks associated with the lymphatic filariasis and mass drug administration intervention. So first they did initial need assessment. So what are the implementation bottlenecks associated with the mass drug administration, and which was conducted using a mixed method approach. The results of the intervention phase, pre-intervention phase, showed that there was refusal to take the drug due to poor knowledge and misconceptions of the disease, poor community mobilization and sensitization, fear of adverse drug reactions, non-adherence to the directly observed treatment strategy, and poor adherence to the MDA protocol and non-participants' responsiveness. So these were the findings as result from the pre-intervention phase. So based on these findings of the pre-intervention phase, a context-specific evidence-based quality improvement intervention was designed and implemented using intervention mapping and plan, do, study, act approaches. These are the quality improvement approaches. Then this context-specific evidence-based intervention was based on 4 key strategies. Basically, they were the strategies for implementing this mass drug administration. So what they did, the strategies were training of community drug distributors, social mobilization, sensitization, involvement of community leaders and other stakeholders, and improving the drugs distribution process. So they used this re-aim framework to guide the evaluation of CQI intervention implementation. So this is the framework. There are a lot of theories and frameworks in the implementation science, which was given by Proctor et al. And other authors. So you will find a lot of literature for that. So in this study, they have used this framework for guide the evaluation of the CQI intervention. So this framework was developed to assess the effects of public health interventions. So this study used mixed method study design, which involved the extraction of quantitative secondary mass drug administration data from the neglected tropical disease database. And then quantitative data include information pre and post CEQI intervention, MDA coverage, and self-reported adverse drug reaction. The results of this study was the findings of the evaluation showed that there was an improvement in social mobilization, sensitization, knowledge about lymphatic filariasis, and mass drug administration process. There was willingness to ingest the medication and adherence to the DOT strategy. This study also showed that there was 6.3 increase in the district MDA coverage and reduction in self-reported adverse drug reaction. And the level of reach, effectiveness, and adoption, this comes from the AIM framework, from the district, sub-district, and the individual participants level suggests that the CQI intervention is feasible to implement in lymphatic filariasis hotspot district based on initial context specification need assessment. So this was from our side. Thank you so much.
Yes, thank you, Dr. Shivangi. And before we take the questions, I have an announcement. So I would like to invite you all to participate in an upcoming virtual workshop on focusing on inclusion with the celebrated and renowned Vicky Roy, a world-renowned photographer featured in Forbes Asia 30 Under 30 in 2016. During the event, Vicky will share his experience of traveling across the country and capturing the diverse stories through the lens of inclusion. The workshop will be a learning opportunity for the young minds as well as the experienced individual, as a conversation will help in reflecting on the existing thoughts. VPhoto would be grateful to witness your participation. So VPhoto is our partner organization, and this workshop will be on 14th March 2023 from 4 p.m. to 5 p.m. So I will share the registration link for the event in the group, and you can also share to the colleagues who are working in public health sector and social sector. Thank you. And if any questions are there, we can take the questions now for 10 minutes for both Dr. Spurti and Dr. Shiva.
Hello.
Yes.
Yes, I'm Dr. Amrita.
Yes, Doctor.
My question is, now as in implementation research, we are not focusing on the outcome, but only the implementation. So how effective is strategy we are using for implementation? So how are we going to find out through the analysis?
So who would like to take it, Dr. Spurti or Dr. Shivangi?
Sorry, could you please repeat your question?
Hello. Hello.
Yes, yes.
Yes.
Yeah. Yeah. As you said that we are going to focus on not the clinical outcomes, but on how effective strategies we are adopting for implementation of a particular program. So how are we going to analyze that whether those strategies are effective?
So that is why the implementation outcomes are there. So some studies measure the patient outcomes also, but that will not be there. Some takes they as a primary outcome. That is the hybrid effectiveness and implementation trials. But there is a framework to measure these implementation outcomes can be measured with the same questionnaires, pre-post questionnaires, or like adoption. I want to take an example for that. If you
Yes.
want to measure an adoption, said whether the program or you have initiated a screening or some in the PHC or somewhere, so you want to measure that whether this strategy is successful or not. So you will see the proportion of increase in screening in this on that PHC. So this is how you will measure that indicator will be increasing proportion of the screening, number of screening.
Okay.
Similarly, acceptability will be measured like perception among. So you will take questionnaires from among the stakeholders like providers or doctors or nurses, whether this program is acceptable to them or not. So before implementation, you will do some uh, data. It will take some data, and then after intervention, you will measure the data.
So like this implementation outcomes, whatever like 10 or 12 points you have mentioned regarding acceptability, adoption, appropriateness,
Yeah.
these we are going to use for our implementation research success.
Success, yes.
Is it?
Yeah, yeah.
Okay.
And
Okay. Okay.
in turn, they will affect the patient outcomes also. Like if the number of screening is increasing, so for depression, maybe there will be change in the patient outcomes, change in the PHQ score.
Okay.
That will be long term, but some studies measure that also.
So first we are going to analyze by these points, and then we are going to see
Yeah.
how is the outcome.
Yeah, that will depend
Okay.
on the like study, whether they want to take it as a primary outcome or secondary outcome.
Okay.
Yeah.
Fine. Thank you.
Thank you, Dr. Shivangi, and hope Dr. Amrita, your doubts got cleared. And
Yes.
yeah,
Yes.
thank you. Any other question? Any other question from anyone regarding implementation research? If you have any questions, you can open your mic and you can talk, or else you can just put it on the chat box. Or else anything Dr. Shivangi and Dr. Spurti would like to add as an end remarks?
Thank you. If anybody has any question, can ask. So, in conclusion, what I want to conclude, like implementation science deals with the conversion of evidence-based practice into the routine usage. So whatever is there in the literature, whatever evidence is there in the literature, so until and unless it comes in the real world settings, we'll not know that whether it will work in real world setting or not. So basically implementation research deals with that. And to measure the success of these implementation activities we will measure with the implementation outcome. This is the crux of the implementation research. Yeah, thank you so much.
Thank you, Dr. Shivangi. And in the comment box, I could see some nice, kind words. Thank you, Dr. Amrita, Dr. Javed, and Dr. Rishabh Rano. Yes, so if there is no questions, then we can conclude for today's session. So we would like to thank all the participants and our speakers, Dr. Spurti and Dr. Shivangi, for today's session. As this wonderful session has helped all of us to dwell deeper on understanding about the implementation research. So this will help us in understanding the broader landscape of public health. We are learning from each other. So thank you, everyone. And I would request Dr. Spurti and Dr. Shivangi to share the slides by today only, so that it will be helpful for our fellows. You can just share it in our group. And regarding the session that I told about, the virtual workshop, I will share the registration link also today, so that you can register and also ask your colleagues to register. Thank you. Thank you all.
Thank you.